A new variant of COVID-19 virus is making a news headline these days. This virus has more than 70 different mutations and seem to be more dangerous than the earliest variant. The biggest question is that this virus, which was hidden for several months, now has made itself visible and has spread across dozens of countries all across the world. So the question is it something that we really need to worry about, or it's just nothing but addition of some other variant of the COVID and we should not be worried about it at all. We should keep continuing our life as we have done post COVID era. So let us try to understand and answer all of these questions. Now, first of all, this new variant is being referred as BA.3.2. It's a new variant of COVID-19. We call it as COVID-19 because as we know that it was year 2019 for the first time when we have basically seen this virus spreading across the world as such. Nicknamed as Cicada, that's very interesting because the scientists who were trying to identify, isolate this strain of virus, what he found that this virus actually made its first appearance in the month of September, October 2025, 2024 itself. But after that, it remained hidden for several months and years, we can say. Same way how the insect cicada keep itself hidden and when it want to hunt, it comes out. It is believed to be descendant of the earlier variant that we have referred as Omicron. Omicron was also referred as BA3. So that's why we are calling it as a BA3.2. As we have seen, first it was detected in the month of November 2024 and the country where we have detected this virus first is South Africa. So now if you try to understand about this global spread, how fast and rapidly is it spreading? So till now it has been detected in over more than 20 plus countries and these countries are scattered across the entire world, whether it is Americas, whether you have Africa, Europe and even Asia as such. So that's why the global we can say spread of this virus is definitely there. And overall in the US itself, more than 25 states are where CDC, that is the main health authorities and body of US, it has discovered the virus. Over 30% cases we have seen in the past few months in the region of Eastern Europe itself, such as country like Romania, Bulgaria, Serbia. These countries are where we have seen a spread of virus. Now again, why cicada? As we have discussed that it is because of its unique nature. The virus has already developed its strain, it has mutated, but even after mutation, it was hiding for the right opportunity. It stayed underground rapidly. And the reason why it stayed underground rapidly is because virus want to rapidly multiply and then when it becomes significantly lethal in nature, we can say when the viral load increases, then it is spread at a large scale. Now it has been under the radar before detection and that's why it is equated with the cicada insect. Question is that if anyone is getting impacted or affected by this virus, what are the symptoms that they need to watch out for? So as per the scientists, symptoms are not very different as it used to be in the time of COVID. So all the strain of COVID-19 causes similar symptoms. So here also people who are affected by this variant, they have shown cough, fever and sore throat. That is a classical symptom. And then as the viral load increases, as the body cannot fight infection anymore, virus keep on multiplying, then the breathing difficulty, which is the number one reason behind the fatality during COVID-19 times, is also seen here. Apart from that, headache, fatigue is something that is seen because the body is continuously fighting against the invader. Loss of taste and smell can be felt by patient in the later stages of the viral infection and then it can also lead to diarrhea or vomiting. Now, the good thing is that even despite showing all the symptoms, virus is not as lethal as the earlier variant. However, there is a concern and the concern is related to the mutation. Virus has mutated and now on this viral strain, 70 to 75 different spike protein mutations have been found by the scientists. And the problem here is that whenever virus mutates to extent that it becomes quite different from the earlier variant, it might evade the immune response. We know that during COVID-19 times, all of us have gotten several COVID-19 vaccines, even booster shots. The problem is that whether this virus would be able to be stopped by those shots, those vaccines, is it not very clear, because if it is very different in terms of mutation, it can easily evade it, it can easily infect it, and thus immunity response will be relatively less. And that's the problem because it is different from the existing strain. However, as far as the risk and severity is concerned, scientists agree overall, whether it is in India or outside, that there is no evidence of higher severity. That means even if people are getting impacted with this virus, we can say the fatality rate would not become enormously high. Similarly, rise in hospitalization also we are not seeing to more than what we should have expected in any general COVID virus, and it is similar to previous variant as well. As far as the effectiveness of vaccine is concerned, there is some work needed to be done because the current vaccines we have, they are more suited to the earlier strain of coronavirus. So if this new strain comes into existence, we might have to reformulate our vaccine because this virus strain will have, or the earlier vaccine we can say, it will have reduced effectiveness, and this has been proven in the lab studies as well. Thus the protects against severe diseases. As far as this viral vaccine that we have taken, it is working, it is protecting against severe diseases, and possible need for updated vaccines we can see in the future also. Now as far as this future outlook is concerned, we might see this virus becoming a part of the life of people, life of the society, because as we have seen in the cases of earlier strain, possible seasonal surge we see, and that generally happens during the month of May, that is during the summer season. Virus start to spread at a rapid rate, and that is what we can expect with the Cicada variant as well. Spread increasing gradually, and if you try to go back and try to think, when was this variant seen first? That was in the month of November 2024, and then it began to spread at a slow rate. It remained hidden for several months, but even when it is spreading, it is not spreading like a pandemic, so there is no fear as such, because even in the last couple of years it has infected almost 20 countries only, and within that 20 to 30% of areas are where most of the patients are found, and most of the patients who have been infected by this virus, they have not been hospitalized. That means after getting general vaccines and after basically using protective measures, they have been able to be remain healthy as such. So most of scientists across world believe that there is unlikely scenario that it can create a major pandemic wave, at least the kind or the nature which we saw in the earliest stage of COVID-19. We can say the peak time that we had in the beginning of this beginning of the year 2020 and further up to several months. Now, as far as India's preparedness is concerned, the government has stated that India is on full alert. No major surge has been reported from any states of India as far as this particular variant is concerned. Genome sequencing of this virus or virus strain to understand it in more detail is continuously being carried out by several institutions all across. And if there is a possibility, high risk group means, for example, people who are immunocompromised, people who are old age, people who belonging to the old age group, as well as those suffering from the lethal diseases such as diabetes, cardiovascular diseases. For them, if required, booster shots can be provided so their immune response can be strengthened against this particular strain of virus. But as far as the possibility of this strain to create a new pandemic wave, as you saw in year 2020, that remains very limited, and the possibility of that happening is very, very low. So that's all about this particular variant. We have to be watchful for it. We have to keep in mind and try to understand what is going on around this entire area, but at the same time we do not have to panic, and we have to be confident that every step is being taken by government all across the world to ensure that again it does not turn out into a new pandemic wave. That's all up for this particular video. If you like the video, please hit the like button, share it with your friends, as a subscribe channel for more content. Thank you very much.